Healthy lifestyle. As we are not dietitians or nutritionists, we cannot give you specific advice on your diet, but we can point you in the right direction with some general guidance. The main link between our diet and our joint pain is effectively how much you weigh. The heavier you are, the greater the strain on our joints. Weight can be maintained by a healthy diet and regular exercise. And simply to put it, if you control the amount that you consume calorie wise through our food and our drink, with balancing that out with the amount that we burn through our daily exercise, it then allows us to control our weight. If you exceed the amount of calories that you intake compared to the amount that you're using as energy and exercise, you will then put weight on. We often get asked if there's a certain food or if there's a certain drink that can help manage joint pain. There is no evidence to support any miracle foods that will help cure your joint pain, but this picture of the plate illustrates the different types of food that we would recommend you to eat and sort of the rough proportions of each part. The plate includes plenty of fruit and vegetables. It's recommended that you eat 5 portions of fruit and veg a day. They are a great source of vitamins and minerals, and in substituting them with things such as biscuits, helps us to lower our calorie intake. They are also a great form of fiber, so therefore it prevents us from having constipation and other digestive problems. Not only this, but they can help reduce the risk of heart disease and certain cancers. A third of our plate should include our starchy foods such as cereals, potatoes, and pasta. They are a good source of our energy, and as well as fueling our body, they are a good source of nutrients. We also have our meat, fish, eggs, and beans, which help us with our protein, but also our vitamins and our minerals. Substituting red meat with poultry or fish helps to reduce our content of fat in our diet, but also by cooking it in a way of grilling it rather than frying it can also help to reduce that fat content in our diet as well. We've got our milk and our dairy, which does include some protein, but also includes our calcium as well, which is key for bone health. By using semi skimmed or skimmed milk instead of full fat milk, reduces that fat intake in our diet, but keeps that calcium intake. Most people in the UK have too much fat and sugar in their diet. These are sources of energy for our body, but by consuming too much means we take more calories in than what we will burn and we can end up putting weight on. Other general tips that we would recommend is your diet should include vitamin C, D, and calcium, which can help contribute to joint health. If you have a balanced diet, you don't need to take these supplements unless are advised to by your doctor. Vitamin C can be found in peppers, broccoli, citrus fruits, Brussels sprouts, sweet potatoes, and kiwi fruit. And vitamin D can be found in oily fish such as salmon, sardines, and it can be found in eggs, fortified fat spreads, fortified breakfast cereals, and powdered milk. And in general, we recommend that you do not smoke, and also by reducing our alcohol intake, it reduces the likelihood of getting linked diseases and also reduces the high number of calories. Drinking plenty of water helps to also aid our digestion. Many people try glucosamine, sulfate, and chondroitin tablets as well. You can buy these from health food shops and chemists. Joint cartilage contains glucosamine and chondroitin compounds. Therefore, taking these supplements of these natural ingredients may help improve the joint cartilage and preventing further damage. These products are not licensed as drugs for osteoarthritis in the UK at the moment because there is insufficient research into the data of whether this is beneficial. However, many people report that it is effective and they appear safe to be used, although they should not be taken for people who have an allergy to shellfish. If you do wish to try them, it's recommended to take 1500 milligrams of glucosamine and 200 milligrams of chondroitin per day. A reasonable trial period to see if it's beneficial for you is 3 months. If you found that there is no benefit after this 3 month period, it may not be worth you continuing with these. There are also many other supplements which have some evidence to support them. Always speak to your doctor before taking these supplements, as they may interact with medication that you're already taking. Some of them have more evidence than others into the effectiveness of it's beneficial for osteoarthritis. For example, we have our green lipid mussels, which contain omega-3 fatty acids. These are strong anti-inflammatory properties, and can then see some benefits for osteoarthritis. But you should speak to your doctor if you are taking any anticoagulant medication before trying these. We also have Indian frankincense. It prevents hormones starting an inflammatory process. So, therefore, for osteoarthritis, people have seen some benefits, and these can be bought in your health food shops. We have rosehip capsules, which are have anti-inflammatory properties and can be bought in your health food shops as well. Ginger is thought to reduce inflammation, and some evidence does support it in the use for aiding arthritis symptoms and managing your pain. And these can be bought in your health food shops, but should not be used with any anticoagulant medication. We are often asked about fish liver oil. However, there is no strong evidence supporting if this affects any of our symptoms for osteoarthritis. Long-term exercise. It's important to find what exercise you find is beneficial for you and what you feel you can fit in as a regular occurrence. Some people find doing things such as yoga or Pilates effective for them. Some people enjoy going to classes such as a general exercise class or doing things such as dance. And some people find a social side of things such as golf, going out and doing regular walking on the golf course. The main thing is adapting it to your lifestyle and finding something that you enjoy doing as well, because exercise shouldn't feel like a chore. You should be able to enjoy it as well.